Hello, hello, hello. Roz here. Hey, everybody. So happy to see you. Count Talk with Roz is back. I have been out of commission because I've been running around like crazy. Still managing M4MM and all the great work we're doing. My brand, Black Buddha, is growing. Lots of time and energy spent on growing a brand and trying to, um, build it to be in multiple states at one time. But I miss you guys. Can I talk with Roz? Please take a minute right now. Um, Tap in, say hi, tell me who you are, tell me where you are, share this. This month is Sickle Cell Awareness Month in September. And this is near and dear to my heart because the reason why I started M for MM and the reason why I'm doing what I'm doing is because I'm a sickle cell mom. My son, Brian McCarthy, 25 years old, is a sickle cell patient. And so the love that I have for him and his struggles with this disease and how it's affected his life and how he still overcomes every obstacle and thrives. We should talk about it and also talk about the use of cannabis that supports sickle cell patients because my son, yes, is a medical marijuana patient and he is doing fantastic. So I want to bring in my guest for today. I have this young lady, man, let me tell you something, how good God is. I'm trying to book myself a vacation and I come up meeting and I reach out to someone and I'm trying to find out how to get some lodging and things of that nature. And I meet this young lady, and not only is she the plug in St. Croix, but she's also a sickle cell mom and told me just by chance that she happens to be her kid has sickle cell anemia. So please help me welcome Elizabeth, or not it's Elizabeth, but we call her Liz. Hey Liz, how are you?
Hi. Thank you for having me.
Absolutely. And my second guest for today is Miss Pamela White. I've been knowing Miss Pam for, I want to say about 3 to 4 years now. She's the executive director for the Sickle Cell Association in Las Vegas, Nevada. The work that she's doing, the work that she's done has been fantastic. She's a sickle cell mom. She's here to also share not only insight of being a mom of a patient and her child, but also how she's mothering and supporting other families who need support and dealing with their own, all the ups and downs of being able to take care of their child in their family. So without further ado, Miss Pam, how are you? Hey,
Hi,
girl.
I am good. Hi, glad to be here with you guys.
So good
Hi.
to see you. So let me
Yeah.
stop. I'll start with Liz. Liz, tell everybody where you are, where you're from, and tell them a little bit about like your child. Like talk about your daughter.
Okay. Hi. So my name is Elizabeth Gabriel. I was born in St. Croix, U.S. Virgin Islands. I'm currently here in St. Croix. I actually go between St. Croix and Orlando. I actually have a 25-year-old daughter named Kimberly's Gabriel, and she is actually a sickle cell patient. And I'm just delighted to be here this evening to share some of the struggles that I've faced as a mom and as a wife in the past as well. I'm just so glad to be here to learn more about the cannabis options for our children. And just so that you know, I also do property management in St. Croix Virgin Islands, but I do have a background in SSA disabilities. So I know somewhat how, challenging it is to be found disabled or deemed disabled once you have sickle cell. Is not that simple, even though it is a disabling disease. So I'll be happy to share some information. And thank you for having me again, Miss Roz.
No, thank you, Liz. I'm so happy to have you. Isn't it nice, Pam? Listen, I got St. Croix now. We got to connect more, and I'm so
Yes.
thrilled to have both of you on. Pam, please share a little bit about who you are, where you live, and how long you have been. Well, talk about your child that has sickle cell, and how long you've been in the role of supporting other families who are dealing with the same thing.
I definitely will. I thank you, Ross, for having me on, and I'm glad to meet you as well, Elizabeth.
Thank you,
My
Miss
story
Pam.
is is that I have two children that have sickle cell, and so
Mm,
I've been in this sickle cell community for about over 40 years. Let me say that. My oldest is 44, and then 20 years later, I have now a son. My oldest is a daughter, and I have a son now. He's 24. So my reason for starting this sickle cell organization is called Bridging the Gap. adult sickle cell foundation.
Mm,
I felt that there was no emphasis, there was no treatment, no compassion or anything for adults with sickle cell, especially here in Las Vegas. So I just saw that need. I saw a lot going on with the pediatrics. The kiddos were being taken care of. There were numerous hematologists there for them. But when it came to the adults, it was just horrible. Like my son would say, with going to the hospital and so on, it will make you feel inhuman.
right.
So
Yeah.
with that, I thought, hey, and then, I never wanted to start an organization. I was going to walk away from this because there were others in the city who were starting organizations, working with the children. And then I heard in my heart, what about the adults?
The spirit.
So
Yeah.
yeah,
Yeah. Yeah.
that's
I,
when
I
I went on ahead. And I
and I
started with two. Let me
and I
say
want
this.
go ahead.
Okay, I was gonna say I started with the two, only my two, because that's what I told the Lord. I said only know two adults, and so now that started. That was in 2019. Here it is, 2023, and we have touched over 200 families that have sickle cell.
Beautiful.
So
That's
I
beautiful.
am grateful.
Beautiful. That's
I,
amazing.
we're going to talk a little bit more about that's such a great name for your organization, Bridging the Gap. For those that don't understand and don't know that, predominantly African American children are diagnosed with sickle cell. It is a genetic disease. It is not something that you catch. It is not something. It is genetic because you have to have two parents, or you may, and not necessarily, but you have to. It's the different chromosomes that want up when you have when you become pregnant, depending on those chromosomes and those genes, you may be, if you are susceptible, if you have sickle cell trait and your mate has it, or if you have the disease, it depends on, and it's almost like a roll of the dice. You never know how it's going to come out, but you could have, a child that is born with sickle cell. Let me ask you guys a question. In your communities, did you guys, with your kids, did you get, like, when did you find out that your child has sickle cell? So for me with Brian, I found out not when he was born, it was 2 years after he was born. But I would love to hear your story.
I'll go first because in the Virgin Islands, it's a little different. My daughter was, of course, born in 1998, and I found out 2 weeks after she was born. I
Okay.
received a phone call from the local clinic, and I was advised that my daughter was tested for sickle cell, which is, I guess, a mandatory requirement in the hospitals. And when I was told, I had no idea what they were telling me. This was my first time even hearing about sickle cell, and basically it was hard because I only heard the bad part. They only told me, oh, it's terminal at some point, and so that's where my journey began. 2 weeks after she was born.
Okay. Okay. What about you, Pam, with your children?
And with me, because they're 20 years apart, my daughter was born in 1979. And I believe at that time, the newborn screening was not in effect.
Yeah.
So I did not know what she had. I just know that when she was a year old and she started trying to walk, she would hurt. She would cry. And we weren't sure what was going on until, I guess, probably a little bit over a year, she went into the hospital. But they still did not diagnose her with sickle cell. We actually did not find out until she was 5. And that's
Wow.
when a doctor from Utah came into the University Medical Center, and he saw a question mark on a baby's chart in the hospital. And he looked at it, and he called me on the phone and said, "Are you sitting down?" He told me, he said, "Your daughter has SC, hemoglobin SC disease, not SS, but SC." And he
Yeah.
said that because it's SC, you probably won't have many problems with it. So we're only going to give her I, little aspirin, that would do it. Well, that
Yeah.
was not the case. Yeah. And then with my son, 20 years later, the newborn screening is now in effect. And so I
Right.
did get that call the 2 weeks later, maybe a month later. I got that call, and they told me that he had SC as well. But they didn't
Wow.
explain anything. They just told me he had it, and you have a good day.
And
Yes,
goodbye.
sounds
Well,
Mm-hmm.
familiar.
I'll tell you
Yeah.
something. My son, Brian, was born 12 weeks early. So he was only a
Mm-hmm.
pound, 13 ounces when he was born. I was diagnosed with preeclampsia and ended up going to the doctor to just do my regular routine doctor visit. Evidently, my blood pressure had just went through the roof, and she immediately had me picked up, transferred to the hospital. And about 4 hours later, I was C-section, and Brian was born. And
Mm.
for 3 months, we were just praying for him to live, right? Because he was in the NICU. During that time, he did receive a blood transfusion in the NICU, and for issues that were going on with him being premature. Prior to us leaving, they did do the genetic testing for sickle cell, but how about the genetic testing happened after he received his transfusion? So
Ah,
his blood wasn't tested for his blood. He had a transfusion, so the results came back that he had a sickle cell trait. Take you 2 years down the road, my son loses the use of his left arm. He loses the use of his right arm. He has extreme warmness and pain in the left side. Then it happens in the right side. Then we are on an airplane traveling from California to Florida, and he passes out in the airplane. And they had to do an emergency landing. And he's 1.5, 2 years old, right? And man, and I just remember I was like, Lord, what's wrong with my child? And so when we finally made it back to California, because they did an emergency landing in Dallas, and then he was checked into the hospital. They released him to go home, gave him fluids or what have you. Didn't know what was going on. Went to Florida, spent some time with my mom, came back to California, and I called his physician. I'm like, listen, something's going on with Brian. And the physician wasn't in, but she said, hey, our PA is in today, bring him in. The physician assistant had no baseline of understanding of knowing what Brian, didn't have any baseline blood work for Brian handy. So he ended up doing a whole entire panel. He said, we're going to just test for everything. And that's when I found out at almost 2 years old that Brian was diagnosed with sickle cell. And
wow.
it took my breath away because he had multiple mini strokes within 2 years.
Mm.
And we immediately were transferred over to Dr. Hyman, this older physician, but a wonderful physician who was a hematologist in Cedars-Sinai in Los Angeles. And she began doing I would say experimental treatment options and therapies with Brian. And he was the first patient in that hospital that received a hypertransfusion where they would take out X amount of units of blood and put in X amount of units of blood in order
Mm.
to lower his hemoglobin level. And he was the first patient that they did it manually. So they used syringes, and they would pull out X amount of units, and then they would push in, and they would take his blood pressure between every one. They would take, and and he was, that was before they were doing it on the machine. That was in
Wow.
19. That was in what the year he was born in 98. So that was in year 2000.
Wow.
Wow.
So
Wow.
it was a lot. And that's why we're having this conversation, right? And
Mm-hmm.
and as moms, and as you're caring for your children, did you see, were your children in and out of the hospital a lot? What Talk to me about that. Let's go from age 5 to 15. How was that for you, Liz?
Okay, so my daughter actually has hemoglobin SC.
Okay.
And what I learned, of course, raising her, the hospitalizations began when she became a teenager. We will have small episodes at home. She'll, cry for pain at times, but everything seemed pretty normal until she started going to school. Then, of course, I'll say more like in her teenage years, where she started experiencing extreme pain, where it will start as something very minor. Let's say, for example, age 15, I would say that it became very aggressive to the point where we
Mm.
needed to seek hospitalization or seek medical care at the hospital. It would be something like, for example, she had a pain in high school. She was playing in a trampoline or whatever. She was having backache. We basically thought it was just, she was taking like, over the counter medication. And then that triggered her going to the hospital. And of course, because of the lack of getting her treatment right away, that put her into intensive care that
Yeah.
quickly, within
Mm.
24 hours. And that's when I realized this seriousness of sickle cell.
Yeah,
Yeah.
which because with the chest crisis, because Brian was in ICU twice. one really, really serious because he had a crisis in his chest and they had to intubate him. And this was between the age, I think he might have been like maybe 6 or 7. So very scary times
Yes.
of just trying to understand everything. Pam, what about you? That age between 5 and like 15, how was that for your children? And were there resources at the hospital? How was that? I mean, because when they're children is different than when they're adults. And we're going to
Mhm.
really get into that.
Right.
Yeah. Yeah.
Right. For me, my son, well, I'm gonna start with my daughter. Like I said, she had her first pain when she was trying to walk. So her first crisis when she was a year old. She would hurt quite frequently for them saying that she had SC. She probably was in the hospital maybe once a month, really.
Really? Yeah.
And yeah, from that age, really, it started at 1 and 15. We had pretty much mastered. We had pretty much mastered this thing. She would get sick. She would come out of the hospital. She was very good in school. She always caught up with her work. So just became a routine. For us, it
Yeah.
was a matter of having a village. The school knew what was going on. Our church knew what was going on. All of the family. So for me, it was just getting that village together for her. Now
Right.
for Xavier was 9 when he had his first pain crisis.
Mm.
And he went just that long to even the doctors were, they kept testing him because his hemoglobin was like 13, 14. And
Wow.
they kept testing him to see, do he really have sickle cell? He never had that. But when he did get that pain, he tensed up so that he ended up with fibromyalgia as well as sickle cell.
Wow.
And so now he's in pain every day because he has this fibromyalgia going on. And so so that was a whole nother trip for us because now the doctors that's dealing with the sickle cell, the hematologists, they don't understand what's going on with him. And so we ended up having to go to California, to the Children's Hospital in California. And so I never forget him, Dr. Coates at that hospital looked at him and he told us what was going on. He gave us the prescription to bring back to Las Vegas. And really all he needed was, along with, if he had any crisis, he needed physical therapy.
Yeah.
So
Yeah.
to get out of the fibromyalgia, he had to go to physical therapy, and had to get in a warm, any warm water in a pool and things like that. So now he doesn't hurt like that, like he
Hmm.
did. You know what to
Yeah.
do for it. He'll get a
Yeah.
massage, or he'll do physical therapy. So
Did you
yeah,
guys did you ever have doctors that introduced hydroxyurea as a because I know they have them on penicillin when they're kids. What
Yes.
mhm.
did they introduce hydroxyurea? Did you support that or did you give that to your children?
I did not.
I
They
did not either.
they introduced hydroxyurea to my daughter at the age, I believe, 16 during
Yeah.
her admission in ICU. And when we, learned about the side effects, it was worse than, it was terrible. So we decided not to go with that option. Actually, my daughter made a decision not to go on that medication.
Yeah, yeah. Well, I should say I made that decision based upon my research on the side effects
Yes.
and felt
Yeah.
like they weren't quite sure when I asked the questions, what should our expectation, and they weren't quite sure as well. I said, okay, well, we won't be taking this, you know.
That's
Um,
exactly what I said.
right.
Nope, not
Um,
happening.
what about you, Miss Pam?
Well, I can say that for my daughter, no, it was not. She was
It
not
was
even
not available
introduced
then.
to it.
Right.
It was
Right.
not available. And then when I did find out about it, I did not start my son on it because they were still looking to see if this drug was going to cause cancer. So
Right.
they were giving it this 20-year binge. Let's see if anything happens in 20 years. So I said, well, hey, that's what we'll do. We'll wait and see if anything happens in 20
Right.
years.
And
So
then we'll look at it. Yeah,
yeah, so
absolutely.
even now he's not on it,
Mm,
but I've heard of good results from hydroxyurea now because now I'm talking to you from the CBO side of it, from the
okay.
community-based organization side of it. I've seen great results. I've had some patients, clients that are on it, and they're doing very well. I had one young
Good.
man who's been on it for a while. He got off, to have a baby with his wife, and he was in the hospital every month. just
Wow.
just terrible. Yes.
Wow. Do they say that when you are trying to have a baby, that if you're the male, that they want them to come off the medication? Then is that why that is? I
Male
didn't know.
or female, both.
Really?
Both
Okay.
have to come off of it at least a year.
Wow. Very
Hmm.
interesting. Well, I know for us, I declined it, and our therapy that has worked for Brian has been the hypertransfusion program. And for those that don't understand it, that with sickle cell, there is no cure for sickle cell. It is a disease that there is no cure. The only
Hmm.
way that you can eradicate sickle cell from your body is by having um, uh, uh, um, what do you call it? A bone marrow
Bone
transplant.
marrow transplant.
Right,
Yes.
exactly.
Right.
And we did. I want to talk to you guys about that to understand. Did you look at that and pursue that at all? Um, we we thought about it, but because of Brian's prematurity, and he was always behind the curve in regards to his growth, and then having sickle cell on top of it, they always want to put it off. But he has been on the hypertransfusion program since 2000, and literally that means that he has been receiving transfusions. His blood gets washed. It is typed and crossed specifically for him.
Hmm.
He was They were doing every 4 to 6 weeks at first. We've gotten to the point now, as he now is 25 years old, he goes in every 10 weeks. It's very much
Mm.
spread out, and it has kept him out of the hospital. It really was. There was a span where of about 6 years that he was not in the hospital at all. Now that was
Okay.
because of the therapy and the management. It wasn't because he didn't like he wasn't having crisis, but I really truly believe had he not been getting those transfusions, he
Hmm.
would have crisis. His crisis was in his arms, his back.
Hmm.
I can remember many nights driving down La Cienega from Inglewood, going into Beverly Hills, trying to hit to Cedar Sinai, and he's in the back in extreme pain. And as a mother, and this is why we're talking, a mother's love, it it just takes your breath away because you can't do anything. And the nights that we spent in the hospital, on the couch, on the cot, on the chair, he was there for days and days at a time. Um, it's only a mother's love that can just give of that child, and making sure that he has everything he deserves. Because even as
Yes.
children, if we're not there and present, I felt like physicians and sometimes nurses would do or make decisions that I didn't agree with, right? And so
Hmm.
I would love to hear about, how did you interact with the physicians, the nurses, the doctors? Tell people why it's so important to be about what they are looking to either give or to support your child in their hospital state.
Well, as for me, my daughter had at least 12 hospitalization 1 year. And how I engage was one of the biggest challenges, I would say, is getting an employer to understand.
Yeah,
Being
Hmm.
employed and getting anyone to understand they don't support you. I will tell you that 100%. They think it's just an excuse, it's fabricated. Sickle cell crisis can attack you at any time. My
Anytime.
daughter has gotten a crisis in the middle of the night, 12 o'clock at night and 1 o'clock in the
Hmm.
morning. And one of the biggest challenges for me is is going to the hospital and dealing with new staff, because of course you got to go through the ER. Once they're teenagers, I see that there's better care and more involvement. But once they hit that adult age, they make it out to be as if they're just going there for pain medication.
yeah,
Right.
They don't realize that pain control is the key to prevent, for you sickling even getting worse. So basically, I don't care if my daughter is 10 years old, 18 years old, 20 years old, 21 years old. I'm there. I'm
yeah,
That's right.
actually there. I'm there with the doctors. I tell them what work. I am on the phone calling her hematologist. I am on the phone. I'm crazy mom. Okay, because I see her. I'm like, now my best friend has been there with me. Her name is JD, and she will tell you, I'll be like, no, she even gets crazy mom too.
yeah. I'm crazy mom too. Listen, we all crazy mom, because they
I'm
be
like,
like,
I'll
That's
get on
right.
the phone. He's
listen,
on
they
the
be like
phone right
They
now.
be like, listen, they say Brian McCarthy's mom is coming, and you better
Yeah,
have it
we're
together.
labeled.
Yes, listen, and I
Yes.
would, and with Brian, they always start with pain management with morphine, and for some reason, he does not respond to morphine.
My
Like
daughter
the
doesn't.
Dilaudid is the best pain from an opioid standpoint, the best for him, and then Toradol, and then of course regular ibuprofen, and going from there. And I would tell them, and I had someone say, "Well, we're going to give him this because this is our protocol," and I said, "No, you're not. It doesn't work for him. And so if it
Yeah.
doesn't work, then he still has to be in this pain with medication, and then you won't give him the right medication for another set of hours.
Oh
So
my
you
gosh,
have to be
yes.
so
Yes.
vigilant, right, Pam?
Yes.
That's
Talk
right.
to us about your like you how you have to get with these nurses and doctors sometimes, honey. You have to get with them.
Let me tell you, I like what you were saying, Elizabeth, with being that crazy mom.
Yes.
That's why I found that I had to have a village. Because again, I was young, I'm trying to work. My child is in the hospital. I want to be at that hospital because somebody has to be there at all times. And what happened on my job at the time, I was a secretary. So you know how secretary have to be on their post at all times. So what
Right.
my co-workers did, they took shifts. They would go and sit with my daughter while I worked. And then
Wow.
they would call me and report to me, or I'm calling them or whatever. So I thank God for that. And then even on the weekends, my church was there. She was never by herself. And even when I could be there, somebody else was there as well. And here I am, I'm just learning this stuff. So sometimes I would take them for their word for it. There was a time that I took her out of the hospital and I took her
Yeah.
to the church. I did. I took her to the church because I'm like, I don't know what they're doing. They want to stick a needle in a navel. They're talking about they wanted to pull something out and get it tested and all. I'm like, no, no, you're not testing on
Yeah.
my child like that. So
Yeah.
I
Yeah.
just took her out. And so we went through a lot of different changes with that. My son, again, now times are a little different. I know a little bit more. So I'm able to advocate even better for him. I did for
I,
my daughter. I had her to get a pain management letter from her doctor saying what works for her. So one day she was an adult. We were at the hospital and the lady is not listening. I got there a little bit late. She's in tears. The doctor's not listening to her. And I said, excuse me, I have something I need you to read. I gave her that pain management letter from her doctor. She looked at it. She didn't say another word to me. She left out, but she came back and she changed what she was giving her. Because
yeah.
again, they want to give the morphine and they want to give you 1 milligram of Dilaudid when you're taking 4 at home or
At
something like
home.
that.
Right.
That's
Yeah.
right. So I showed her what works for her and she did come back and change it. But
Well,
yeah, I can give you some stories.
even in the ER, and this is something, and for all those that are listening, thank you guys for listening and joining us tonight, because this is so critical. This conversation is about sickle cell and the mother's love. And all three of us have something in common where we have cared for children that are diagnosed with sickle cell. And the reason why you see, like, I want more money going towards organizations, more money going towards
Yes.
research, because
Yes.
you see three moms that are very engaged, but this is not the normal. You have so many families that don't have the village, they don't have the resources, and that child is in the hospital by themselves. Let's talk
Yes.
about like how important it is for, like, nationwide, Ms. Pam. There's sickle cell organizations across the country, and how important
Yes.
in the role they play in helping and supporting families.
I have found that here, as I've started in Las Vegas, it is so important because I don't care how old they are. You need an advocate because now you got a mom who's in there with her child, and yes, she may be crazy mom, or she may be broke down mom. She might be
Right.
that, oh, I don't know what to do mom. So she needs someone there who's going to talk to the doctors and to the nurses for her child. I've been to the hospital with mothers whose child had to have surgery. I've had a 8-year-old who had to have his gallbladder removed. And
Wow.
so, that mom was very upset, but I was there to be there with her and comfort her and be that compassionate person that maybe the nurses and the doctors would not be. Advocating, I've found that is so important. Well, you're talking about an 8-year-old, the mother's there and needing advocating. I had
Yeah.
one who's in his 30s and they're about to put a trach in his throat because
Mm.
they don't know about the acute chest syndrome
Oh
and what
my.
was going on with him with that. So I went in
Yeah.
and I advocated for that, and got their they had not even called his hematologist. I called his hematologist, and she came in and made the difference because they had him with an infectious disease doctor.
Oh
So
my gosh. Yeah.
yeah, so now that person, he's doing well. I had one who called me. He was in the hospital in a corner. He says, "I think I'm going to die here tonight. I just want somebody to know where I was, what's going on with me before I died." I said, "Oh no, not on my watch." So
Oh,
I got up, I went out there with him, and we just got it straight. I told them who I was, what I do. And the nurse came in and she said, "So what can we do to make you more comfortable?" They would have let him
right.
sit because he
Yeah.
had no one to advocate for him. So
Right.
that advocacy is so important.
And Liz, you mentioned something when we first came on about the social service side of this and the support that's needed. My
Mm.
son was fortunate enough to get SSI when he was still under 18 to support him. And we didn't find out about it until he was maybe 15, that we could have been receiving it all throughout his
Mhm.
childhood for and having him through Social Security be diagnosed. I mean, have the disability services and support. Talk about why we don't know about this and how if you don't get it early under before you turn 18, how it's so difficult afterwards as you turn over as you become an adult.
Okay, so actually, I've been working with Social Security disabilities for quite some time. I've personally, I'm not employed by Social Security, but I do work for third parties, and I've been trained by Social Security. I have a great team of, great team that we all work together. We all learn together. One of the things
Mhm.
that I've learned with Social Security, I mean, I'm gonna go with the SSI because that's the only program that is available if
Yes.
you are a
Mhm.
child. Okay,
Mhm.
that's the only program you'll be eligible for. Um, they look at the parents' income. And even if you're a single
Mhm.
mom, that can exclude the child. So you can be medically deemed eligible, but technically you're ineligible. Okay,
Mm,
so these are some of the things that parents need to learn. And it's actually a challenge. And I wish that I can advocate for them because when you learn about it, you can make things happen. Now, as you become an adult, what they start telling you is, oh, you can do sedentary work. So they look
Mhm.
at what did you do before? Like, for example, I applied for my daughter, and just answering the questionnaires that you receive once you submit that application can
Mhm.
disqualify you. They use that against you. Oh, well, you
Mm.
say that you don't have any issue standing up in manning a register, or you stand up for 8 hours, or whatever the case is. They don't realize that, yeah, you can do these things because you need your income. You are now
Right.
starting college, you're trying to help mom,
right.
support a household, and then you're saying they're not eligible. So basically, what I can say is not just it's better to try to get that, receive those benefits ahead of time, before the age of 18, so that you can become more potentially eligible for benefits. It's not a lot, but I will say this: even if you're disqualified for the funding, let's say your stipend that you get every month, or your checks that you get every month, let's say SSI, even if you don't receive the monies because of an asset review or anything like that, you're still eligible for state programs such as Medicaid. You're still eligible for that. You're eligible for a lot of other discounted college, and things like that. So there are benefits to it, and I think that a lot of families need to be educated and try to get some kind of advocates in the hospital that can actually help sickle cell family, because it's a family thing. It's not just the patient.
Yes.
It's
Right.
a sickle
Right.
cell family. It's a family.
Yeah, and it's
So
the resources are SSI, your state Medicaid. My son. So I'll tell you guys something that was just extraordinary for him as a child. He would go to. They had a camp called Camp Boggy Creek here in Florida, and it was all, and they would have different children related diseases for each week of it during the summer. So they would have, one for epilepsy, one for children.
Mm.
They had 1 week for sickle cell patients. So they came all throughout
Wow.
Florida, and your doctor would, you get the application, you fill it out, the doctor signs off on it or what have you. You check in. I mean, I remember when Brian went, he was 7 years old the first time. That's because you start when you're 7 and you can go all the way until you're 14 or 15. And I was so scared. And he came home, and it was like he had the best time where he could be around other children that have, that know exactly how he feels. But the counselors, they have this thing called a French fryer. Like when they get in the pool, when they get out, instead of them going and just drying off, they would put them in these big old, like it looks like it looked like a not a microwave, but like these
A heater?
it's like a heater, right? But it's huge. And they would put them in front of it to dry it off, because we know with sickle cell patients, when you get wet, and it's not drying off, it's that when it's the moisture, it's the even in Florida when it's 85 degrees, that could trigger a crisis. And
Oh yeah.
Immediately, extreme temperature changes.
yeah,
Immediately.
so I'm just saying, it was so many resources. The number one thing I would tell families, if you know a family that has sickle cell, go find your social worker in the hospital. Go let them
Yes.
do an assessment. Ask them for what resources are there for you. That's their job. And if they don't make that person available, you demand for that social worker in the hospital to support you. That's their job, to be able to understand what you're going through, what you need, and how they can make that child's life better and your life better. So, I mean, that's my advice on that.
Yeah, Roz, let me say this, that you're absolutely right about that. But to show you how behind things are here in Las Vegas, I had a social worker call me. She said that we have sickle cell patients come here and we have nothing to offer them when they're going out. So she said, so I looked up on the webpage to see if there was anybody doing anything for adults with sickle cell. And so
Yeah,
she would call me from this particular hospital. She would call me whenever she got a sickle cell patient, and she
yeah.
would refer them to me. But because
Well, I mean,
they don't have and
and this is a great
don't
segue.
want.
This is a great
Uh-huh.
segue. If you weren't on earlier, Pam is based in Las Vegas, and she has her organization called Bridging the Gap, and this focused on the young folks that go from once they turn 18. And my son went to about 21, that he was still in the pediatric side. But once he
Yeah.
turned 21, he was definitely transitioned. The level of care is that you get once you turn 21 versus when you were in the pediatric population is so poor, it's
It
ridiculous.
is. It is. Absolutely.
It is
They
ridiculous.
ignore you. They think you just want
Yeah.
pain medicine, no callbacks. They don't send your prescription out to the pharmacies.
All those therapies he was getting as a pediatric patient stopped.
Yeah.
Like
Yes.
we were like, oh my gosh, like why can't we get a referral for a transfusion? They're like, well, we don't
Nope.
do that. Why can't we get this? We don't do that. It was
Yes.
Right.
atrocious.
Yes.
Yes.
Atrocious.
And the
So tell
same thing here is.
us,
Oh, go ahead.
so no, I was gonna say, tell us why when with Bridging the Gap, I mean, you were spirit led. Like, you know what? I'm not going to focus on the pediatric side. This is a population I want to focus on. And what are some of the
Right.
main challenges that you're seeing with this population?
Well, I'm seeing what we were saying earlier, that there's still no compassion. There's still a lot of education and awareness that needs to be done for adults. It's almost like they expect for ones with sickle cell to die at a certain age. We didn't expect to have to deal with an adult population of sickle
Yeah,
cell patients. So they're not even ready for it. It's hard to get the doctors to come to lunch and learns, to come out and hear and see what's going on in the sickle cell world. It's just ridiculous here in Las Vegas. I think they're doing better in Atlanta, California, places like that. But here in Las Vegas, we are trying to find a way to move the needle to get things different here. And I think it's coming. I really think
yeah,
it's coming. Las Vegas is now on the map because of what we're doing here. And I find that even I'm thinking your son is getting apheresis. Is that what it's called?
yeah. It is. So he's on a
Okay.
machine. So he goes there. He goes to Shands now. So that's where I want to talk about. That's a great segue, because I want to hear from you guys. Like, as your children are now adults. So my son is 25. So how
Mm-hmm.
did it feel when you let them go to the hospital by themselves for the first time? And do you do that right now? Because I was like, oh my God. And and he got it, man. He
Well,
checks himself in, he gets his blood work. I mean, you tell me, Pam, tell me, Liz, how was it the first time?
okay. I'm gonna start this one because my first time for my 44 years old is when she moved away from here to Texas. So now she's away from me. So I can't go to the hospital with her. So I mean that was just a given. You call, you going, I'm going too. And the same thing with my son. Now, his first time I was out of town. Again, I called him to tell him about something I was doing. It was a lot of fun. And he was like, uh-huh. And I said, what is wrong? And he said, I'm at the hospital. I like to panic because I was not there. I couldn't get there. He said, Mom, I'm fine. I know what to do. So, but there are times that even there, and they're in that pain. And that's all I thought about was him in the pain. But, when you're there and they're in so much pain and you're saying, okay, he needs the payment. I've done some things that I probably shouldn't have done, and I'm not going to even say it on this talk right now. But I have to say,
right? Exactly.
That's right.
Exactly.
He's 24, and if I can help it, no, he's not going by himself.
Exactly. Liz, what about you?
Oh, you want to hear my story? I'm gonna put the little Caribbean spin to it.
All right now.
So I left my daughter in Orlando while I transitioned back home to St. Croix. And she feels like I'm a little crazy, don't want to tell me when she's going to the hospital unless she absolutely needs me. So I start making phone calls. I go through my list and I start calling those that I know I need to call. My daughter's in the hospital. Here's the location. You need to go. I start calling everyone to go. Please go there.
Right.
I don't want anyone lying to me. Make sure they're seeing her. I start calling security. I start calling the main number. I start calling her doctor, her hematologist, leaving messages. And basically, I do recall one of her admissions. I called in a mobile masseuse and I said, I need you to go and gave my daughter a massage at the hospital, and all the nurses were cracking up. They was like, your mom is special. But I went, and then of course I will get on the plane if I can't sleep, because I lose sleep when she's that way. I can't eat because I'm always nervous.
Yeah.
My appetite goes away totally. It's traumatizing because I don't think that a lot of people really understand sickle cell changes so rapidly. Because like I said, you can have a pain and it turns into acute chest. Basically, your lungs shut down and you have to be intubated, and then you need blood. Your blood starts depleting, your hemoglobin starts going down. And normal range is what, 7 for a sickle cell patient? 7, 8?
7, 8, maybe 9.
7, 8. Imagine, and they're depleting that rapidly. So I will get on a flight. I don't care what time it is. I'll be on the plane the very next day, and she'll be like, "What are you doing here?" I even got my sickle cell luggage, very tiny. I'm out. I'm always ready. I have all my Caribbean ointments. I bring my old tablets. I'm like, they're taking too long. Pop these right now.
Right. That's what I didn't want to say, Liz. Okay.
I'm telling you, hurry up. The nurse is coming.
We might get into that. Like, listen. So everybody that's joining us, we're having a discussion about sickle cell anemia. You have 3 sickle cell moms here talking about how we have raised our children with this disease. We're able to talk to one another and really just commiserate in the love that we have for our children, but the care that you have to give. And this is just a great segue because, I created M4MM in response to the fact that my research on cannabis, and I wasn't a consumer, didn't know anything about smoking weed. I didn't know anything. But when I started doing the research on the pain management option and having my kid who was 17 at the time, and I'm knowing that eventually you might need to utilize cannabis as another option of care, I started M4MM. So if you guys, I don't know, I will tell you now that Brian is a medical marijuana patient. He has his card. He attends FAMU. He's our advocate on campus. He's the campus director. He's in pharmacy school he's in pharmacy. He's a 2nd-year pharmacy student, studying in pharmacy and endocannabinoid medicine. He just did an internship at Walgreens and as well as at True Leaf on the cannabis side. And he consumes cannabis and he knows when to do it, when he's feeling, because remember, the pain is acute sometimes, hitting here. But sometimes it's musculoskeletal where you just feel it's a body ache, right? Yes. And he's True Leaf, and shout out to the True Leaf folks. When he went to the dispensary for the first time, they sat him back in the back and put him in the consultant area, had someone come out and really walked him through options. Delivery, flower versus tincture versus RSO versus the gummies. Talked about, do you have a day pain, a night pain? They really took time with this 18-year-old kid. Maybe because they knew that was Roz McCarthy's kid, so I wouldn't. But I will say
Right.
this: they took such good care of my baby, and I would love to hear from you guys the use of cannabis in sickle cell. Your thoughts?
My daughter actually just started mentioning it to me. I don't know a whole lot about it because I'm not a user, of course. But she says, "Mom, I'm so sick of the whatever medications they're giving her, all the withdrawals and everything, from constipation to rebound
Itching.
headaches.
Yes. Oh,
Rebound headaches is one of them. It takes them a long time to even get back to normal, up to 2 weeks sometimes for them to
Yeah.
regain strength. And actually, that's one of the things that she started exploring. She's actually seeking information to, go that route.
yeah.
So
We have
I'm
a
glad I'm here.
We have Dr. Joseph Rosado is our medical director with M4MM, who would gladly give time to maybe help point them in the right direction. We also have Dr. Terrell Newton, who is a Black pain management doctor, who happens to also be. He used to be a referring physician. He's one of the medical officers at True Lead as well. Super knowledgeable, super uh, tied in. I what my goal is to educate and make the use of cannabis less, less of an issue
Fun.
with our community, right?
Yes.
Yeah.
And look at this as an option because it's not about smoking. Because sometimes Brian, like a part of his sickle cell is he has problems sleeping.
Yes.
Yeah,
Mhm.
he has problems sleeping at night, bad insomnia, and sometimes he has other little things that happen that are related to the disease itself,
Yeah.
and he
Yeah.
knows how to consume using gummies. He can use a tincture. He's figured out what works for him, and honestly, he's like, "Mom, I'm good." He went to, I mean. He just went. He just let me tell you what he did. That I was like, "Oh my God, why you didn't call me?" So Brian has a port that sits right here and it's underneath his skin. And he's had it since he
Yeah.
was little. They change it out, they put a new one in or whatever. So he's been going
Mhm.
to Shands in Gainesville and getting his transfusion and put him on the machine. And for some reason, the port is kind of, I guess wearing out or whatever. And he told me they were going to do a port study. This kid goes and gets a support study, and I guess they figured, well, we need to replace it. Doesn't call me, doesn't tell me, gets it replaced, go underneath the knife and gets it replaced the same
Mhm.
day. And then I'm like, Brian, you didn't call me. And so it's a beautiful thing because he has a live-in girlfriend, and he and Sydney, he's like, well, Sydney was with me. She drove, I drove there, she drove me home. And I'm like, I'm seeing my baby as a man now being able to manage this disease. And I'm just so proud
Right.
of him.
Wow.
Yeah, yeah,
That's beautiful.
yeah. It
Yeah,
is a beautiful.
that's transitioning, and they
Yeah.
all have to go through that transitioning point. So I even have a transition program that we did it last year and we're gonna start it again. We're starting at age 12, from
Okay.
12 to even 25. Whoever needs it, we're going through those transition things that they do. I wanted to say that my son went to camp also, but it was a cancer. It was cancer and sickle cell. As a matter of fact, I kind of talked them into adding sickle cell to this camp. So that's when I
Nice.
was out there volunteering. So he went to the camp and he couldn't get in the pool because out here in Vegas, it's got to be 115 degrees before he would get into that pool. So what they did was they put him in a scuba diving outfit so that the water didn't touch him. It was like, so he was the only
Yeah.
kid out there in the pool in a scuba diving outfit. So that was
Yeah.
his kind of his experience with that. But as he got older and going through the things that he goes through, he didn't do the apheresis. I have a lot of clients that are doing apheresis and they're doing great, like your son is. My
Yes.
daughter didn't get that experience as well, but I have to say that my daughter did go to college. She has a bachelor's in accounting. So, it was difficult. I gave up I was in college. I stopped going to college so that I can help her to make sure
Yeah.
that she had what she needed. And now my son, and then when my daughter was in college and she ended up in the hospital, I was there. She was in Colorado. And I
Yes.
got it
Yes.
hard and I was there, and I don't know. They told me I got there in 2 hours. I don't know. But she was.
Any of your kids use cannabis as as another therapy for?
My daughter does. My
Okay.
son, he has not balanced that yet. He said he does not like the feel of it. But my daughter, how it is at that age, she started smoking it. She was
Yeah.
just smoking marijuana. but it
Right.
helped her. It helped her to sleep. It helped her to eat. And I was that mom that was saying, it is all in your head. This stuff is not working. You just, because I didn't understand it. So
Right.
now that she's older, and plus after I met you and Nicole, I've
I
learned a
tell you.
lot more about it.
Yeah.
And
We
so I've got it over to her. And so now she's using it differently. And I thank
good,
God
good,
for
good.
that.
Well,
Hmm.
and there's also different ways. I know for me, when I suffered my traumatic brain injury about a year and a half ago, I'm not the biggest, like, I didn't know how to consume, but there's a device, it's called the Da Vinci, where you can put dry flour. So you get your flour from the dispensary, you put it in this device, you just crumble it up in there, you grind it in there, and instead of rolling, instead of having the smoke, it just, you vape. So you're just pulling the
Oh,
vaporizer
yeah.
from the flour. And that
Hmm.
was what made the difference for me with my traumatic brain injury, because my head was so foggy from that concussion and whiplash and that TBI that I would have these
Mm.
moments of syncope where I would feel like I'm about to pass out. And I would just pull on that vape just a couple of times and felt immediate relief. And I
Oh,
really
wow.
want to, if folks are out here, I want you to look at cannabis as an option. It is a plant that has done wonders for my kid. I know other children. We're going to later on September 30th. Nicole Buffong is doing another a conversation on sickle cell, but we're going to have the kids on. So the kids are going to be able to come on and talk and be able to share their story. We have a brother and sister who the brother is in the cannabis industry and he also consumes. And we just have
Mm.
to normalize that if this is an option that you think, and if you need support in helping to see if this could make a difference, I would I will tell you, if anyone says I don't like how it makes me feel, they need to reduce the THC level and increase the
Mhm.
cannabinoids,
Mhm.
CPG, CBG rather, CBD. There's so many different cannabinoids and terpenes inside the plant that have such a great entourage effect that you don't have to have this super high THC that's going to make you feel
Right.
all make you feel weird. You want something that's going to manage your pain, manage that achiness that you have, and also maybe uplift your mood and get you in a good place. And you guys know, like I know, when you have a kid on morphine, Dilaudid, the time it takes for them to recover from that, from the constipation, the itching, the headache, the all this,
Mhm.
it's you just feel for your kid, and
The
so
Right.
vomiting, ongoing vomiting.
the whole nine
Oh
Yes,
my
yards.
gosh.
Yeah,
You're
ongoing
right. The
vomiting.
stomach problems, stomach aches.
the stomach aches, the stomach
Yes.
issue.
Yes.
Yes,
Yes.
yes, yes.
Yes.
The breaking down in hives, the whole nine yards. So, you guys,
Yes.
we have covered so much tonight. I'm so grateful.
Mhm.
Please tell us just what's your thoughts on cure? Like, what do we see out there? Are there anything that you've been seeing, any therapies? I've heard about a couple of companies that are looking at some different things that might be able to help with pain management. But have we heard anything in regards to a cure for sickle cell, and what should we be doing?
Okay. I can speak on that.
Yes, yes,
There's gene therapy.
yes.
Therapy has found out that is phenomenal. I have a few clients that have gone through the gene therapy and they are sickle cell free. The ones that
Really?
do the bone marrow transplant, they have the sickle cell trait, but gene therapy, you're sickle cell free. And
Are they
so
doing that in
again,
Vegas? Though? Are they doing that therapy in
no,
Vegas? It's
no,
no.
no.
Where is
Usually
that
it's back
available?
east. It's in
Uh,
Virginia, maybe Washington D.C. area, but no, they're not doing it here in Vegas. And there are two gene therapies, not gene therapies, but the medications. There's two new ones. One I think they're not using anymore, but there's one called Oxbryta that my both of my children are using, and my son seems to be doing very well on it. My daughter,
Okay.
even her hemoglobin level is usually at about an 8. With this medication is now at 10 or 11.
Oh,
So
wow.
nice. Yeah.
yeah, she's doing great. My son is doing much better since he's been on it. So yeah, I think those two are something to look into.
Wonderful, wonderful.
And,
Well,
and I
we
want to say real quick before we leave, I do have a support group. We meet every fourth Saturday of the month. And this month we are talking about cannabis and the use of it. And we're having on the families that you just mentioned, that brother and their sister. They're going to be
good.
our guest speakers for
Yeah.
this.
So Broderick and his sister.
Yes.
Know that we have folks within the M4MM family. If you have anyone that needs some support, that needs to talk to a doctor about how do I get started in looking at cannabis as an option, You have Dr. Carmen Jones that's in Vegas, but we have other physicians that are nationwide that can talk to families, talk to patients. The bridging the gap is so critical. We all have children that are 24 or older, and the care they need, they're not children in regards to pediatric, but they still need hands-on care and support. And so I'm so grateful to have you ladies on tonight. A mother's love. This is our conversation. This is our little village, right?
Yes.
Right.
And we want to do more. And so next year, let's figure out how we can do more and make a difference and be able to. I see a lot of the sickle cell organizations. Some of them are not very supportive or have not adopted or even looked at cannabis as an option. And my goal is to at least introduce and educate them on this as an option. So I'll invite you guys to join me as well.
Yes,
and you have to come to one of our conventions. We have to have you at the Sickle Cell Disease Association of America's convention. So that's where everybody comes, and they will get to meet you and hear all about it.
Let's get that teed up, and we will come. Well, I'll come as an organization and as a mom, but we'll bring Dr. Terrell Newton. He will go. I mean, when I tell you he's fantastic, he will help to break down why cannabis can be such a great option for patients that are over the age of 18. So let's do it. Okay.
All right.
I thank you guys so much. Thank you, ladies.
Thank you so much.
Listen, honey, we have covered so much today. Thank you, everybody that's tuned in. Can I Talk with Roz has been off the grid for a little bit, but I am back. I miss this. I miss you guys. I miss being on. I miss talking about issues that are important to me, and I miss educating. So I want to let you guys know that I'm super excited to be back. I thank you for tuning in. Make sure you share this. And make sure you join me next time on Can I Talk with Roz. I have a new time, a new format coming soon. And just take care. And I love you guys. Be safe. Have a great night.